National Incident Manager of the Presidential Steering Committee on COVID-19, Dr. Mukhtar Mohammed, he joins us now to throw more light on some of the, if you like, worrisome things we're hearing about COVID. While we start, first, glad to have you join us, by the way. Let's start with the third wave, which it's confirmed now is here with us, fallout particularly of the Delta variant. How prepared are we, both at the federal, the state, and the rural levels?
So absolutely, we have been in a constant level or state of preparedness since the pandemic started last year. And mutations are not new. When we saw that happening around the globe, we also tightened our belt. We knew that with the variants that are declared as variants of concern, we have to take every step in the first place to ensure that they do not come into the country. But that is just a race against time. You can only delay it because eventually it will come. We have successfully kind of delayed the entry of the Delta variant. If you recall, when it started happening in India and around the globe, and even in Africa. And I think we are happy with some of the steps that we have taken. We have restricted entry of passengers into the country, particularly if you are coming from countries where this dangerous variant is circulating. And the steps may be seen to be a little severe, but they are necessary. And passengers, of course, groan about such conditions because they have to stay for quarantine for 7 days in government-approved quarantine facility. But it is just a measure that has to be taken to ensure that we slow down the entry of this variant. It is inevitable that this variant will eventually enter. In terms of public health preparedness, which is people to continue to observe non-pharmaceutical interventions, now that is where we have issues, and we have raised our concerns severally, through the various media. But we are working with the general public, with the states, with the stakeholders, at least to ensure that the public is fully sensitized, that people are aware of the implications and people try to protect themselves at personal level.
Right, and talking about the Delta variant, which is driving our third wave, well, from the briefing yesterday, we have been told that 6 states are the ones where we're seeing this hotspots, especially in Akwa Ibom, where we're seeing, a lot of this being detected. And the next question will be, since 6 states are driving this high numbers that we're currently experiencing, what are we planning to do really to keep this, variant contained in those states? Are we looking at precision lockdown, for instance, like it's been experienced in some countries? Australia comes to mind.
Absolutely. So we had earlier on, if you recall, about a couple of weeks ago, we have declared 6 states and the FCT as high priority states. Those states, it's not because we have Delta variant circulating in those states. It's because we have predicted that should Delta variant come into the country, these states are more prone to having that infection and to having more circulation of the virus, and therefore we have taken this precautionary measure to sensitize the states. Now, those 6 states and FCT, now we have Akwa Ibom. Akwa Ibom is the latest entrant, into this group, because Akwa Ibom has not appeared very high up in the states that we were even noticing the high burden of the pandemic. And what has happened is that the samples that were tested in Akwa Ibom last week, out of the 23 samples that were positive, about 19 were found to be Delta variant. So that tells you that how fast this variant can go, and we've seen even the number of cases in Akwa Ibom now rising, in very high proportion. So the measures that we have taken is we had a meeting with the state governors, we have sensitized them, and we said that actions need to start taking place. Lagos is also getting overwhelmed. I mean, the numbers are rising. We've even seen mortalities beginning to rise in Lagos now. On daily basis, they're recording.
Even the deaths.
Exactly. Yes, they've seen the numbers also rising, hospitalization and deaths. So it is just the constant state of preparedness. We know what to do. We need the state governments to also support the activities that need to happen. We have to prepare our healthcare facilities to make sure that when numbers start to rise, we'll be able to accommodate this patient. Right. And our hospitals do not become overburdened. Our hospitals are already weak. So with the rising number of COVID cases, it will be very easy for our hospitals to be overwhelmed.
Yeah.
And that is why we are sensitizing them, we are getting them ready, and we're also doing everything possible to ensure that we limit the spread in the public.
Right.
And that is why we are calling on the public to ensure that we continue to observe these public health measures, and the state governments in the high priority states to actually commence some level of enforcement.
Wash your hands, use sanitizer, wear face mask. Just to say it out there, so they will get it. All right, 500 banned. I read that. Passport says for a year. But we were discussing earlier on, not maybe not today, but way back. We're talking about 10,000 that came into the country, remember? And they did not stick to the rules. And I was asking her, don't we have policies that make it a must priority, that this is what you must do, and if you don't do it, you get punished this way or that way? Because they didn't obey it. You want to clarify that?
So there is a level to which you can enforce certain rules, especially if the rules are obeyed at personal level. For example, people are required to wear a mask. You are not there, you are not everywhere, to check that people wear their mask. It's only those that get caught that get punished. Now, regarding the travelers, there is a protocol. If you come back from a journey to Nigeria, the first thing is you're supposed to have a negative test before you even enter the country. And if you come in, you present your negative test result, you are allowed to go and isolate at home. You go to your house, you go to your final destination, but stay isolated. Even within your family, have limited contact with the people who come to you. But Nigerians, people don't comply. We know that people don't comply. Immediately they come back from travel, they even embark on another travel, maybe within Nigeria or outside. And the level of compliance we know is very low. Now there is a risk to that. The risk is that because you have not yet been confirmed negative after 7 days of coming back, you can transmit the infection. But people don't like to obey. And the same thing with people who came from restricted countries. We try to put them in quarantine for 7 days. It is mandatory. But I tell you, you see the amount of effort our officers go through to convince people to go into quarantine. Some will threaten our officers, some will become violent, some will overpower the small security officers attached, some will go to the quarantine facility. They will do whatever possible, bribe officers, whatever, and get. That is the negative attitude that Nigerians are demonstrating. We have tried to enlighten them, we have tried to provide them with the information that is needed, the leaflet. Some will call people in high places, and try to drop names for you, that they will go out. So it is part of everyday challenge. But I assure you, anybody that comes into this country and evades quarantine, we are taking these serious measures. We have published the earlier names, and now we are going to publish these names of over 500 people, that have evaded quarantine, and they are going to have their passports banned for 1 year.
You know what? Let's wrap this up because time is really not our friend. The fact that we still have a huge number of unvaccinated Nigerians. Yes, we just received some vaccines courtesy of the United States government, which we're grateful for. But that's a drop in the ocean. If we want to get to that 70% to give us that herd immunity, let's talk about the implication of those who even have an opportunity to get vaccinated but are refusing these vaccines to the rest of us.
So the only weapon that we have now against COVID-19 is trying to get as many people vaccinated as possible. That is the lasting and assured weapon that will make sure that at individual level you don't become sick, you don't get hospitalized, and you don't die from COVID-19. If you do this, at least at individual level, you are assured. And when we have these individuals that constitute 70 or more % of Nigerians, then at national level, we can say that we have conferred on ourselves some herd immunity, because even if people get infected, now they will not become hospitalized or they will die from the disease. So we appeal and we call on Nigerians. This is a collective battle. It is not just for you and your family. You have to convince your neighbors, convince everyone that people need to get vaccinated. And these vaccines are safe, And that is what we see now in the Europe and USA. We see that with the level of vaccination they have, they are opening up their societies. It is not that the infection level will go down. The infection level may even go higher, but hospitalization rates become low and less people die from COVID-19.
And get vaccinated. Dr. Mukhtar Mohammed, the National Incident Manager of the Presidential Steering Committee on COVID-19. Thank you for joining us tonight on the program.
Thank you.